Hi, everyone. My name is Victoria Lay. I am currently in the Master's of Nursing program at Mount Mercy University, working through my practicum with my final project focusing on improving health equity for refugee and immigrant families within a school nurse setting. I currently work in Cedar Rapids as an elementary school nurse, where over half of my students, which would be around 400 out of my 800 students, are refugee and immigrant families. So through my research, through my assessment of my research, surveying, interviewing of several different stakeholders, community members, staff, and parents, I found that there was no specific streamlined plan or approach that was currently in place to assist our refugee and immigrant families to access basic health care, preventative screenings, or receive health information and education when they register to a new school. Currently, there is no district-wide mandatory cultural humility training that schoolhouse staff need to complete in order to provide culturally competent nursing care, as well as the cultural information on specific cultural considerations and resources within our school nurse manual that we use daily are out of date and really inconsistent with the actual diversity that's experienced within our communities. The evidence-based practice shows that refugee and immigrants who attempt to navigate our complex U.S. healthcare system often encounter cultural, linguistic, socioeconomic, and structural barriers that limit their access to healthcare. Even when there's low cost and culturally appropriate local health services available, my families are often reluctant to utilize those services just due to discrimination that they have faced in the past, maybe some mistrust from healthcare from where they grew up in Africa, Mexico, Micronesia, where my families are from. So I think that trust needs to be gained back. Um, and that's what I found through the research as well. Reducing discrimination and promoting an understanding of human values that target the approach to focus on health education, health promotion, disease screenings, and prevention lead to improved health equity. Culturally and linguistically sensitive education, training of health professionals, close collaborations of stakeholders, partnerships, and advocacy are the key elements to promise best practice for this population. An efficient and reproducible way to improve the health of vulnerable populations is for healthcare professionals to participate in cultural and linguistical training programs to better understand the diverse needs of our specific cultures. At times, we may feel like they might not want to do something, but there's probably, an emotional piece, a cultural piece that we're missing. So we can't judge, we have to understand. And that's kind of what the research showed. Some gaps and barriers that I've found and that I've assessed would be the increased influx of refugee and immigrant families from many different parts of the world. So currently we have families from several different countries in Africa, including Haiti, Congo, Burundi, Togo, Cameroon, Tanzania, Kenya, etc. And then we have a lot of families migrating from the small islands around Micronesia, as well as Mexico. So with all of the different cultures, it's hard to address them as frequently as they are coming in. Depending on the specific school and its unique needs, there may be some time constraints where nurses and healthcare staff may struggle to fully integrate the toolkit into their busy workflows. Health office staff are hired on and off throughout the year. So depending on the time constraints, there may also be a lack of training and support. So nurses and health office staff, they may need additional training and coaching on how to best utilize the toolkit. Another gap would be the willingness of the healthcare staff to utilize the toolkit. Due to the size of our district and the amount of healthcare staff, there is not always direct supervision over the staff to assure that they are using the toolkit and using it effectively. The plans for the toolkit are to establish a standardized intake process for acquiring pertinent information, health information from new refugee and immigrant families in order to complete a needs assessment and to understand the assistance that they may need in regards to accessing healthcare. So the toolkit would be a resource for school healthcare staff to access information and education to bring awareness to the health considerations specific to each culture that's served. This will help to assist conversations regarding the health differences between different cultures. The toolkit will include health resources to assist families from different cultures. So this includes picture handouts of local medical, dental, and vision providers, as well as translated forms in each of the languages. We're now seeing a lot of different cultures, and within those cultures, there's several different languages, especially different dialects. So they may not be able to understand, say one of our families speaks Swahili. Well, there's different dialects of Swahili. So being aware that even if you get an interpreter, they might not speak the same dialect. So just providing that educational and awareness piece to help guide conversations. In order to implement this toolkit, it will be important to ensure healthcare staff are equipped with the educational resources to provide the equitable care to these families. So it'll be important to understand the staff's concerns and their questions, seeking their support by including them in the conversation, because at the end of the day, they're the ones that are providing that hands-on care. So you're going to want to understand their concerns and things like that. Another key to implementation would be to improve the awareness of available resources to assist this population to access healthcare, including transportation, interpretation, health promotion, and education services. So there's only certain places, certain clinics here in town that work really well with refugee and immigrant families. So you're going to want to choose those places that are aware of their needs and can help facilitate them to accessing that basic health care. Continuously educating nursing and health staff on cultural considerations to create that cultural competency and humility, as well as bringing awareness to personal biases towards specific cultures. That is a big key to implementation as well. Evaluation of the effectiveness of the toolkit will include gathering feedback directly from the refugee and immigrant families who receive that nursing case management, kind of understanding how it impacts their access to care and improves their health knowledge and literacy. It'll be important to interview the nursing staff who utilize the toolkit to understand how it impacted their ability to provide that service, see what worked well, see what could be improved and things like that. It would be important to directly observe nursing and health staff that interact with these populations and look for improvements like cultural sensitivity and care coordination. So how to, help nurses and health office staff provide the best care for our families. And then it will be important to track metrics such as appointment attendance, preventive screenings, and patient satisfaction before and after the rollout of the tool. So before it rolls out, getting a basic understanding of their concerns, what questions they have, and then implement the toolkit. And then afterwards, see how it impacted not only their ability to provide that service, but for the refugee and immigrant families who are impacted by it, see if it actually works. Those would be really, really good things to look at for implementation or for evaluation. But that is my project. Thank you for listening.